Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And I have to tell you, we are so excited. We are preparing for our brand new tongue tie symposium of 2021. And here with me is one of our speakers to chat a little bit about her presentation and the symposium, Michale Chatham. Welcome, Michale.
Aloha, good morning from Maui.
Oh, it is so lovely to see you there and you sitting there outside there in nature. So you are in Maui. So tell us a little bit about where you are exactly, what we're seeing. You mentioned it before when we had a little offline chat, what we can see in the background there, and tell us a little bit about yourself.
So I'm in Hawaii on the island of Maui and in the middle of the Pacific Ocean. And so from my lanai, you can see part of the South Shore, the North Shore on this side, and then the South Shore on this side. So I have an amazing view of the Central Valley of Maui and the West Mountains. And then I am halfway up Haleakala, which in Hawaiian means the house of the sun. And I'm about 4,000 feet. So I have my sweater on, I've got my scarf close by, and I'm sitting out here on my lanai this morning doing a little work and having a chat with you.
Oh, wonderful. Well, thank you for showing us the beautiful area where you live. And now let's talk a little bit about more about you. It's all about tongue tie, that symposium, and you have been into the subject, into the field for a long time, right? Over 10 years that you created your practice there. And that must have been at a time when we were just starting out to learn a little bit more about tongue tie. Obviously, tongue tie has been around since humanity, but the awareness and the research has certainly picked up. So tell us a little bit about how you got started. And what I'm particularly curious about also is what kind of barriers did you have when you started out at the early days there?
Oh, interestingly enough, I really did not feel a lot of barriers. I feel like when I first started down this rabbit hole, it was for personal reasons. So it was, I had 12 years of migraines and health issues, and I was looking for a solution for myself. And at the time, I had five youngish children, and I had home birthed and breastfed them all, and we lived on a small farm, and we grew a lot of our food and ate organically. I had kind of like a modern homestead, so to speak. And I had breastfed my children and transitioned them to solid successfully, and we really didn't have a lot of the common issues that were now associated with what we would call posterior tongue tie or tongue tie, even though several of my children would have been diagnosed or categorized as tongue tied, which is really interesting. And so when I was having issues with a dental occlusion issue, I noticed it had come back from my childhood orthodontics. I was having these headaches, and so since I was married to a dentist at the time, I immediately went to, is it the jaw? Is it something cranially? And exhausted all of those resources there. And finally, I just went to a local orthodontist and said, put me back together. So I can die looking halfway decent. I was a real drama queen, right? Um, and so he said, you know what, you've got a tongue thrust. You would benefit from some oral facial myofunctional therapy. And I'm like, what is that? And how do I do that? And all of those things. And so I actually found out what it was. And then I found someone who did it, and then realized that at the time I had the credentials to be able to take an intro course. So I took one course. And then I also had therapy done by a certified oral myologist at the time, and my headaches went away. And then as I began to study, I took another basic course. So these were like 30-hour courses, one, another, an advanced one, another one. I taught with one. I mean, I went down deep in that rabbit hole of myofunctional therapy. And at one of those courses, somebody mentioned that I had a posterior tongue tie. So I went and did all the things we knew to do at the time and had it released. And then and then came out of braces shortly after that. And I had just this massive change in how cranial base, what looked like cranial bones that had changed. All, of course, all the musculature had changed, and I came out like this new woman. The dirty little secret was that several weeks after my tongue tie, I experienced a ruptured appendix, a collapsed lung, and sepsis. And I spent 11 days in the hospital fighting for my life, literally.
Oh, wow.
And so I spent the next 3 years kind of redesigning my approach to the identification of and the sequencing of care around tongue tie. And then also what I realized through that, Kristen, was that there were a lot of other people who had also had these experiences. They were
Interesting.
unexpected outcomes. They were deeply rooted in trauma. And I began to really look into, okay, well, why aren't some people getting their outcomes? Because in the success groups, I call them success groups, not support groups, everything looked like it was completely positive, and this was something that wouldn't affect anybody in an untoward way. And I'm like, whoa, what is this discrepancy I'm seeing in the glowing reports over here? And yet there's this other world of people like myself who were really adversely affected by having such a simple soft tissue procedure done. And so after that, I began to completely treat my clients very differently. And I stepped back and I just looked at the whole being, the whole person, the person's belief systems, their outcomes in a different way. So separating my outcomes as a clinician from their outcomes as a client, and finding the places where those met and those did not meet.
Very
That was
interesting.
really important to do. Yeah. So that was kind of like how my practice shifted. And as far as barriers, you know, I created within my ex's practice one of the first integrative clinics in the country, where we had lactation support, structural integration, and the release all under one roof. And so we quickly became a fly-in, drive-in destination out of zip code
Right.
practice in the Midwest, and did really amazing work. And even in the babies, I could see like, oh, whoa, this one's got a very interesting, I call it the trauma terrain. You know, let's take this and look at this very differently so that we can get this family their outcome rather than causing even more untoward effect for them.
That's absolutely fascinating. Thank you so much for sharing your very personal story there and how that all came together, and you know how you created the practice and the work you're doing now, helping these families there. And that leads me right into the topic of the presentation that you will have with us: trauma, timing, and tenacity, navigating care when frenectomy does not help. And I can imagine that this is, you know, a topic that, you know, you just mentioned it. People think that if they have a release or a frenectomy, oh, everything, it's like the silver bullet. Okay, everything should work. The breastfeeding, chest feeding should all of a sudden, you know, work out fine. Everything is fixed. The baby can sleep better. You know, all the wonderful things you hear. And then you have the case and it doesn't. So
Right.
I can only imagine the parents, you know how devastating it must be for them, that they
Yes.
think like they've done the right thing. And you know, what parents want their little one to feel any pain, right? So they went through this procedure which they know is painful for the baby,
Mhm.
doing it, weighing the benefits versus the risk and all that, thinking they have done their due diligence, and then this happens. I can only imagine how terrifying that must be for the families too.
It's very frustrating because in the world of informed consent gives you all of the options and possibilities. That's what informed consent is. However, a lot of times what's sold to them is this panacea of the silver bullet. Like you said, well,
Mm,
we'll do this. And then they read in the success groups, oh, well, it's all going to change. And that's what initiated the article that I wrote years ago. Is your baby a tetherberg or a tether flow? That means, is it a superficial restriction, or are there deeper issues underneath the
mm,
water? that can literally sink your ship, so to speak. And then what I realized was already traumatized families were going through a controlled trauma of a release and then not getting their outcomes, and then coming away with even more discouragement and even more lack of enjoyment of life in general and their child, which, oh, that is a travesty. That is something that we do not want for humanity at all.
Right.
And so when I practiced in Dallas before I came here, then my practice became fly in, drive in for people who had not gotten their outcomes. And usually with a really good intake, I could find the missing piece and go back in and kind of eliminate some of the residual issues that honestly could have been eliminated prior to release. You don't even want to say that sometimes. However, that's the whole premise of the mentoring I do now. Is I believe in the 80-20 rule. We can usually eliminate close to 80% of what's going on before we even do a release. And then the release is just there to even get more biological function and optimal breastfeeding biomechanics that create this trajectory of form and function. So it's a very different view now of, okay, what can we do? What is in our power to do even prior to a release?
Instead of seeing the release as, okay, let's get this done, and then we work, with,
Exactly.
wound healing and oral exercises, looking at it differently, going like, what can we do beforehand, or do we then even need to do the release at all?
Exactly. What
Yeah.
are we dealing with here? Let's get a real handle on the fact that, yes, there's a visible frenum there. However, a good functional exam, a properly done functional exam, is going to identify the exact areas that you need to restore function in. And so restoring function in those areas is the key. That's the magic. And sometimes a release is warranted for that, and sometimes it's just not. So we're going to talk about in the talk that I'm going to do, I'm going to present some case histories of situations where the child was going to be sent for a release, and we got the family time to heal, time to move the trauma, time to adjust, time to take care of themselves first, and put that child on a pathway of oral anticipatory growth guidance, so that we could watch this unfold and then time a release if it's necessary, so that the family can handle it, so that they can really embrace all of the things that are going on around them and have control and direct it as well.
That sounds absolutely fabulous. I'm so looking forward to your presentation to learn more about this, and of course also our attendees there too. Michale, thank you so much for chatting with me here. Before I let you go, one last quick little question. What nugget of wisdom would you want to share with our viewers here today?
Oh, a nugget of wisdom, like in general or about my subject?
What you feel you want to share here with our audience?
The nugget of wisdom that we do not know what we do not know, that there are 22 states of matter in the universe, and we've been taught 3 of them in school: liquid, solid, and gas. And then, if you believe the 4th phase of water in physics, a gel. And there are 22 states of matter, and they all operate under different laws in the universe. And as long as we are on this planet, if we can stay open to growing and learning things that are not just dictates in our fields, but open ourselves up to the vastness of nature, then it increases possibility exponentially.
Well, thank you, Michale. That was beautiful. Thank you so much for that beautiful nugget of wisdom there, and for chatting with me here today. It was an absolute pleasure.
Thank you, Kristen.
And for our viewers, if you would like to find out more about this presentation and the other presentation in the Tongue Tie Symposium, this presentation, by the way, will be live on September 14th. please visit goldlearning.com. You'll find all the information. We have 2 full days of tongue-tied symposium, 10 presentations at your fingertip, live, and of course recorded if you can't attend the live presentations. So go ahead, visit goldlearning.com to find out more. Thank you again, Michale, for chatting with me, and thank you to all our viewers here. Bye-bye, everyone.
Bye, aloha.